Hi, my name is Dr. Kim Quandt, and I'm a board-certified veterinary surgeon. In this video, I'm going to talk about cranial cruciate ligament injuries in dogs and the surgical treatment option TPLO, or tibial plateau leveling osteotomy. The cranial cruciate ligament is a small ligament that lives in the center of the knee joint in the dog. This model here is of a dog's knee with the femur or thigh bone on top and the tibia or the shin bone on bottom. If we move the kneecap out of the way, the cruciate ligament is right in the center of the knee joint. It's a short ligament that connects the two bones together, and it's responsible for preventing a back and forth motion between the two bones. We make a diagnosis of a cranial cruciate ligament injury based on our physical exam findings. In a dog whose ligament is torn, we can feel this back and forth motion or instability that we call drawer motion. We often take radiographs or x-rays as well to help confirm the ligament tear. On the x-rays, we do not see the ligament itself, but we expect to see some swelling inside of the knee and maybe some early signs of arthritis. Cranial cruciate ligament injury is the most common orthopedic problem that we see in dogs. The ligament is the same ligament that people have called the ACL, but the injury is different between dogs and people in a couple ways. The first thing that's different is the way the injury occurs. In dogs, it is a degenerative process, which means that the ligament becomes weaker over time and only a small amount of force is required for the ligament to tear. Most dogs tear the ligament when they're just running or playing in the yard. In people, it's a traumatic injury, meaning that they have a normal, healthy ligament and it requires a lot of force in order for it to tear. The reason that this is important is because in dogs who tear one ligament, they are much more likely to tear the ligament in their other knee. This is because whatever degenerative process was occurring in the first place can happen on both sides. We know that statistically, dogs who tear one ligament have about a 50% chance of tearing the other side within about 18 months. Unfortunately, we haven't found any successful way to prevent this, so I don't recommend that we do anything different to treat the normal leg, but I like to make owners aware of this. The other way in which cranial cruciate ligament injuries are different between dogs and people is the treatment that we do for them. In dogs, we still recommend surgery to stabilize the knee because we know that once the ligament tears, it will not heal back together. In most dogs who do not have surgery to stabilize the knee, they continue to have limping and they'll develop progressive arthritis in the knee. The surgery that's done is different than the surgery done in people. In people, the ligament is often directly repaired with a donor or a graft ligament. This type of surgery used to be done in dogs many years ago, but we found that it was very common for them to re-injure the ligament. Therefore, we had to come up with different options that worked better in dogs. Because of that, there's several different procedures that can be done nowadays in dogs. The gold standard treatment for cranial cruciate ligament in dogs in most cases is TPLO, or tibial plateau leveling osteotomy. The idea behind the surgery is that instead of repairing the ligament directly, instead we're changing the way the forces are directed through the knee. The way that this works is because the top surface of the tibia has a flat surface to it that the femur rests on top of. That flat surface is angled or sloped downward toward the back of the knee so that when dogs walk and bear weight, the femur presses down and has a tendency to slide toward the back of the knee. In a normal knee, the cruciate ligament would hold the femur in place and prevent that motion. Once the ligament has torn, every time a dog walks, the femur moves a bit and slides backwards. That motion is what is the problem with the injury, because when it happens, it causes pain, inflammation inside the joint, and that can lead to arthritis forming. With the TPLO surgery, we have found that if we can take that slope on the top of the tibia and make it level or flat in relationship to the ground, the femur then has a nice solid surface to rest on top of. So when dogs are walking and using their leg, it stays stable even without a cruciate ligament. In order to make that flat, we can't just shave down the top of the tibia because there's important cartilage and structures that we need to preserve. Instead, what we do is go down below the surface of the knee and we make a cut through the bone with a special circular shaped saw that looks like this. Once we've made that cut, we can then move the top portion of the bone and we rotate it right in place. So we just kind of twist this portion in order to make that slope flat. We then take a bone plate and screws and place it across the cut to hold everything in position. Over time, the bone will fuse together or heal just like a broken bone would heal, therefore making a permanent change to the top of the tibia. The positive side of this surgery is because we're permanently changing the shape of the bone, we don't worry about re-injury of the ligament in the future. The downside is that cut we make is similar to a broken bone, so we have to be careful in the recovery period to prevent any issues with healing. At the time of surgery, we also look directly inside of the knee joint to confirm that the ligament's torn and to check on the meniscal cartilages. These are two cushion-like cartilages that sit between the two bones, and the medial meniscus can often be torn at the same time as the cruciate ligament in dogs. If the ligament is torn, we trim out the torn portion. If it's normal, we leave it be. The total recovery time after TPLO surgery is about 3 months long. The most important and often the most challenging part of recovery will be controlling how much activity your dog is doing. They often feel much better within a short period of time and want to get back to normal activity before they are fully healed. For the first 2 weeks after the surgery, they'll have an incision on the inside of their knee that they should not be allowed to lick. We sent home an e-collar or cone-shaped collar to help prevent licking. During these first 2 weeks, you should only take your dog outside on a leash for bathroom purposes. Inside the house, they should be prevented from doing any high-impact activities like running, jumping, playing, or using stairs. When they're unsupervised in the house, they should be confined to a smaller room or a crate if they're used to that. After 2 weeks, we see patients for a recheck exam to ensure their incision has healed and that they're progressing in their recovery as we expect. After the 2-week recheck exam, if everything's going well, you can begin leash walks with your dog. This is an important part of their rehab process because it gets them out and using their leg, but in a controlled fashion. You begin with about 10-minute walks that you can do a couple times a day, and then gradually increase the length of these walks by about 5 minutes each week. We'll do this walking from the 2-week period until 2 months after surgery. During this time, you still want to prevent any high-impact activities like running, jumping, and playing. After 2 months, your dog returns again for a recheck exam. At this point, we take x-rays or radiographs to look at bone healing. We expect the bone to either be fully healed or pretty nearly healed at this point. As long as everything's going well, in the 3rd month of their recovery, they can be gradually returned to normal activities. This is done by allowing them short sessions of higher impact activities, such as playing in the yard off leash, playing in the house, or anything that they would have done before surgery. You start with short sessions similar to the walks, about 10 minutes, and then gradually increase the length of the sessions if they're doing well. At the end of the 3rd month, they can return to full normal activity, although we do tend to see dogs continue to show improvements up to 6 months after surgery in many cases. The prognosis after cranial cruciate ligament injury with TPLO surgery is very good. We expect dogs to return to about 95% of normal. This means that they should be able to do all the activities they did before the injury, like running, jumping, and playing. They will develop some arthritis in the knee from the injury itself, which may progress over time, leading to some stiffness and occasional soreness. The most common complication that we see after TPLO is infection. This occurs in about 10% of dogs. The best thing to be done to help prevent infection is to prevent them from licking at their incision. If they develop an infection despite this, we typically have to place them on a long course of antibiotics, and in some cases, if we have trouble clearing the infection, we may recommend removing the bone plate and screws. Most dogs will keep their bone plate and screws in place for their lifetime, but if we have a problem with the implants, such as infection, we may recommend removing them. The good thing about this is that once the bone is fully healed, the bone plate and screws are no longer needed. So we can remove them at this point without having any impact on the surgery. We expect dogs who have an infection to do just as well in the long term as dogs who do not. Another type of complication we can see after TPLO surgery is any damage to the repair that was done. This can happen in the form of screws breaking, screws pulling out from the bone, or even the bone breaking somewhere around the implants. Fortunately, this is very uncommon and only occurs in about 1 to 2% of patients. Unfortunately, it can be very serious if it happens and often requires a major revision type of surgery. Dogs who have a complication like this often do not do as well in the long term compared to dogs who don't. If this type of complication occurs, it's often due to an accident, such as a fall, a leg getting stuck, or a jump from a high height. That is why it is very important in their recovery to restrict their activity and avoid anything high impact. The last issue we can commonly see after TPLO surgery is in cases with dogs who have a normal meniscus at the time of surgery. About 5% of these dogs will go on to tear their meniscus at some point after surgery. If this occurs, they do require surgery to trim out the torn portion of the meniscus. Thank you for watching this video. If you have any questions, please direct them to me or your dog's primary veterinarian.